So today's presentation is titled Research Ready, Technology in Dementia Research During COVID-19, and we're so thrilled to have our guest presenter today, Dr. Lillian Hung. Do you want to go to the next slide, Lillian? Wonderful. So hi, everyone. My name is Avery, and I'm the Provincial Coordinator for Knowledge Mobilization at the Alzheimer's Society of BC. I'm also joined today by my colleague Daisy, our Research Program Coordinator, who you'll likely see in the chat box, sharing related resources and providing support throughout. At the Society, we receive many questions about research related to dementia, and we're always looking for ways to act as a knowledge translator and bring research findings into the hands of knowledge users like yourselves. In that spirit, we are thrilled to be hosting a local researcher, Dr. Lillian Hung, who will share her exciting research with you today. So Dr. Lillian Hung is an assistant professor of nursing at the University of British Columbia. As well, she is a clinician scientist at Vancouver Coastal Health Research Institute and a clinical nurse specialist in older adult mental health. Lillian's research focuses on how technology and the environment impact the care experiences of people living with dementia, and she's done extensive work engaging people living with dementia as co-creators and collaborators throughout her research process. Dr. Hung is a previous recipient of an Alzheimer's Society Research Program Award, and we are so pleased to support her work and learn from her experience and expertise. So without further ado, I'm very pleased to pass things over to Dr. Lillian Hung.
Oh, let me see. Oh, yeah. Well, first of all, I want to thank the generous funding from the Alzheimer's Society, and thank you for that very kind introduction, Avery. And I want to acknowledge that my workplace lies in the unceded territory, traditional homelands of Musqueam people. And I'm very grateful to have this opportunity here to talk about technology research for dementia, virtual care that we have done in the past during the COVID time, and some of the possibilities in the future, what virtual care can look like and what we want it to look like. So you can see the coronavirus, the COVID-19 pandemic has really impacted all of us. It has taken a significant toll on people with dementia. So when we had the provincial lockdown last year, Dr. Jim Mann and I wrote this editorial, and I noticed Dr. Jim Mann is here with us as well. So this particular virtual issue that we wrote for the Journal of Dementia was about polling some of the evidence about using touchscreen tablets to support dementia care. In this particular article, we recommended a list of other papers that they are available, and they you can Google them, and you can have open access. If you go Google and you type in Jim Mann and you just type in touchscreen, this article should show up. Then you will find the access to the papers that talk about using touchscreen tablets for dementia care. So this particular virtual issue also included one of our scoping review paper that we have done with a group of patients, partners, and family partners. And when we did the scoping review, just to look at the landscape of research have done in the past, how people use the touchscreen tablets like iPad or Android, and how that support people with dementia, we find that there are three ways that the tablets have been providing really good support. First of all, it really seemed to be helpful to engage people with dementia to have some meaningful activities with the caregivers. It helps to decrease the behavioral symptoms, and overall it also have really good positive effects on quality of life as well. So during the pandemic, many of us, especially for people with dementia, are feeling anxious and lonely, which is very understandable. And caregivers also seeing declines of their loved one with the disease, either they're at home or they're in a care setting. We heard about the family and visitors bans in the long-term care and hospital, which could make patients and residents feel confused about why their family stopped visiting them. Families experience a lot of stress because they also have a hard time to get information about their loved one, especially when there are times when the facilities are having outbreaks. We heard about the residents in the long-term care homes and not allowed to leave their rooms, and they're being kept in the room for a very long time, weeks and months sometimes for some facilities. And you can imagine it's just a very difficult thing. People are kept in the room with very little or nothing to do. It can be very heartbreaking as well. So technology can actually help in these difficult times, challenging times. We have been using technology to help people to connect with smart device. And in this particular paper, I talked about how we use a device. Well, we've been using this particular iPad in Vancouver General Hospital to help connect patients with their families. So this is a poster that we presented at the Alzheimer's Association last year during the summer. So our research on the iPad project had provided some knowledge about what worked and what did not work when we work with people with dementia with different stages of the disease. We included patients with later with moderate or more advanced stages of the disease as well. We started with investigating how to use iPad to deliver recorded family videos to help reassure the person with dementia. This research was funded by the Alzheimer's Society of Canada in 2018. That was before we had the pandemic. We work with patient partners, and you can see the names on the poster that we have. We have Dr. Jim Mann, we have Mario, we have family partners, we have Neil, we have Annette and Christine. We also have physicians and nurses in the study to do this work together. We learned that there are actually some barriers. If you look at the center of the box about the barriers about using the iPad in a care setting. So it's human factors. We find that the nurses were telling us that they not to assume that they just give them an iPad, then they will be able to do this work. They also need educational support and resources to do this work. And we also noticed that in our study that when we did our observations, and there are mechanical issues as well. And the iPad can be very heavy, and it's very hard for the person with dementia of the patients to carry. And if they are using it for a longer time, and also people if they're lying in bed or when they're in a chair, that those chairs comes in different sizes, and when people are sitting and lying back, and the angle of the iPad needs to be adjusted to be right for the person to see. So there are some mechanical issues there that we had to solve. So we end up come up with adding a mechanical arm and putting the iPad on the stand with a view that what we call an iPad on wheels. And you can see it in the lower, in the picture here. Then let me see, I don't know, you can see my cursor. Yeah, so that's the iPad that we end up with having this mechanical arm. And there's a view there. This is kind of like a medical device like the blood pressure, the bladder scanner that we have in the hospital. It has this kind of similar structure. So it makes it a little bit more familiar, easier for the clinicians to use. The picture here shows the team in Richmond Hospital that they use the iPad. We also find that there were some ethics that people need to work through, because people with the condition of dementia is complex. Each person is very unique and different. So the nurses are telling us that getting to know each person, making sure the approach they use is person-centered, which is vital in order for them to make this work. For example, in the Richmond Hospital, you see the team there that their nurse team leader, Cheryl, she told us that she had a Japanese patient. Let's go back to there. And who was described as like agitated, unsettled. It was very tough for her to be there at that time. And through her family, the nurse leader, Cheryl, she told us that her family said that she really liked Japanese movie. Why don't we try it? So the staff they were creative and they went to the YouTube channel and then they find those Japanese movies for her to watch. And like since then she was no longer agitated. So you can see that, sometimes people are confused about, why they are put in that space and having nothing to do, or maybe they were bored, and having some meaningful activities for the person that was very helpful. And, the Japanese movie was also familiar for her, and that kind of helped her to settle as well. And so you may ask, like, why use the iPad to connect with the person? Why not use phone? Right? A lot of people have smartphone. In our study that we learned that the face-to-face contact is really extremely important. We rely on facial expressions to read people's emotion, which is a very important social cue. When we look at the person's face, and we kind of understand if that person is, is nervous, is anxious, or that person is calm or is happy, and understanding what you're saying. So we rely on those facial expressions to understand the person. The phone the phone gives you the voice. So there's one way to hear through the tone of the voice. The text message, if people read text message or emails, those are the kind of maybe the worst or the most difficult way to connect, because it's really left to our imagination to guess what the other person is feeling, right? So you lose that kind of emotional connection by not able to see that person's face. You can see here in this picture that the nurse is reading the facial expressions and providing support for this particular family member, and she was asking questions. By reading through her facial cues, and she can understand that the person was understanding her, or is she like anxious, or if she's having a question or not. For people with dementia, they rely on more than words to communicate. I think people with dementia really rely more on emotions as well. Emotional connection is absolutely crucial. Our family partner, Neil, he's also here with us, and he told us that in the study, and he said that there is a deep connection between the person with dementia and family, because they have spent long years of their lives together. So if you look at this example here, this person, Helen, she didn't know, she was a patient in Vancouver General Hospital. She didn't know the team, and there's so many different people in a very large clinical team. She didn't understand why her daughter was not there. Often she would ask for her daughter. But when she saw her daughter's face on the iPad and listening to her daughter talking to her, she felt much more reassured. So that sense of safety was really important to her. So during the pandemic, when many groups activities were canceled in the care setting, people needed to have positive things to do. Like we all need to have something for a little bit of fun and in our lives. So maybe take a look at this particular this particular video that we have recorded during that time. So we can see that there was a lot of fun in the video. That's our staff, Gail, and during that time, during the pandemic time, when our patients have limited access to their family, and she helped patients to play games. And we sent this video to the daughter to let her know that her mom was doing okay and having a good day, and that meant a lot to the family at that time. So here is a website that we use these apps on for the games that we have on the unit that we download on the iPad. These apps are free for anyone to download, and if you would like to download them, you can go to this website. Is called ectodementia.com. And they also have games in different languages as well. If people speak Chinese or different languages, they have game that designed for different cultures. And they also have one-person game or two-persons game as well. So you can have people playing the game together and you can even make it intergenerational. It can be very fun. And these group of games or apps that they have compiled, it's based on, they have done study to look at what is some of the games would be best fit for people with dementia. They took away that games might be like very time sensitive, like with the clock that might not work so well with people with dementia. They also look at all the details about font size, colors, and all those things, and making sure that they work well for people with dementia. So I want to show you this article. It was published last year on virtual cycling. So yes, this particular research done was with a very small sample, and it's early evidence, but it clearly showed that people with dementia in a care setting like long-term care can engage in a program like this, virtual cycling. So any of the care facilities, like if they have I'm going to show you later with a pedaling machine, what we call APA, and anyone could run these programs. And I know that Villa Cafe, our local facility here, has been doing something similar. And in this particular study, that people with dementia, that they were engaged in 25 minutes self-paced, like they could pedal faster or slower. It's completely up to the individual, and it's seated in a chair, and they look at a virtual cycling tour. And so it's provided some really good benefits. For me, it makes sense. So if it's not possible to go outside, virtual cycling can give people some benefit. So we went ahead and tried it. So in this picture that you can see on the left side, you can see our rehab staff, Brian. He asked our patients to choose a place that they would like to go. And he finds these virtual cycling tour on YouTube. And I remember that we had a lady that she really wanted to go to Italy. And in this video that you see on the left-hand side, I think he is riding in Stanley Park. So everyone is different, and sometimes it's a particular place that people used to travel to or where they grow up. And when people went to those places when they to cycle, it also brings memories or reminiscence as well. Yes, you can look at this. The screen seems a little bit small on the iPad that we have. It's the same iPad that I show you, the iPad that mount on the mechanical arm, and that view that we had. So I am recently working with a group of engineering students at UBC to see if we can project images on the wall to create a much more immersive experience. So you can see the picture on the right-hand side that a person is riding a bike. And the background, it's a projected image, and it helps him to, when he cycles, it makes him feel like that he's outdoor, that in, I don't know where that is, but it looks like it's like a park. I mean, it could be a Central Park in New York, then there's building behind there as well. So I love this piece of equipment that I mentioned about the APA. It's short for active passive activation. in rehab science. It's essentially, it's just like an e-bike, it has a motor to help the person. If the person who is frail and maybe it's hard for them to get going, so we can turn on the motor to help the person to get going. As the person develop more strength, and then we can dial up the resistance to train up that person's muscles. So it works really, really well. And you can see that she was just sitting in that that regular chair that we have. People, if they have their own wheelchair, they could be sitting in their own wheelchair as well. Have their wheels locked, and put this APA in front of them, and then people could exercise. I mean, we all know that physical activity has a lot of benefits for our physical and mental health. So this is a recent paper that was published in the Journal of Rehab and Assistive Technology Engineering. You can see that again, our patient and family partners are co-authors. This talks about a toolkit that we developed, and there's a QR code on the paper. I mean, if you have a phone, if you hover over it, and it will take you right to the website, or you can also Google it. And if you type in VCHRI iPad, then you will find our website, which is also free access. Another piece of technology that we have tested is the silent disco headphones. These headphones are a lot of fun. They have been used by young people. They have like these they call them silent disco parties, and they put the headphones on, they could turn on the music and then have a party in an apartment, so that they won't get into trouble, because the music only going to the headphone, it's not actually causing any noise. So people can have a good time and a lot of fun. And we thought it was useful for young people, then that may be useful for older people as well. So we brought it in to use it with our patients with dementia. And there's also a particular advantage about using the silent disco headphone is these headphones help to eliminate the environmental distractions, because it has the features of noise canceling. And the headphones was very also helpful in another way, because it can be you can connect a whole bunch of headphones to a central transmitter. So people could use their wireless, right? So they could have it on their head, and they could hear a song or join a music program, but they don't have to be physically together in a group. These transmitters, they are run by FM signals. So they could actually go a very far distance. So we can have patients in the individual room and a music therapist in a different space, and run the program with a group of people. Another thing that when we did our study, we find that when people come into the music program, not everyone are able to sometimes these music program could run for an hour or longer. And some people just do not feel like that they were able to sit through the whole program. So people have the urge that they need to get up and walk. So with the wireless features, the people were able to just have the headphones on their head, and sometimes they will be walking around to the hallway and come back to join the program again. So that is also another advantage of the headphones. And we often see people who just get up with the headphones and go to a space, and they would dance. Yeah, so it's really fun to see how people enjoy the headphones. Yeah. So I don't know, let me see if I could play this. I don't know, you can see it. So this is Ben here. And Ben is having a really hard time, a very great time, that he was listening to a song that he loved. And I don't know, you see a little bit of yellow that next to him, that this little bit of yellow is another patient that he is actually was not in a good mood. But that didn't bother Ben at all. Ben just turned up the volume, and he's danced, he enjoyed himself, and that was very interesting. And we find it very helpful. Oh, you can probably hear a little bit of music of that song that Ben was dancing about. Another project on the use of the social robot, another study we have done. Many of you have probably seen and heard about Peril. Peril, it's a baby seal, and in our study we find there actually, there are some barriers about. There are lots of benefits. This is actually a scoping review that we have done to look at the benefits and the barriers about using the social robot. When we look at all the literature, the benefits includes like it helps to reduce negative emotions and behavioral symptoms. It also helps to improve social engagement by having the robot. People find that they are more engaged in conversation, and it also helps to promote positive mood and the quality of the care experience. So the title on this paper, I presented this paper about Peril in Tokyo. The title of this paper is "The Seal is More Than a Companion." In this paper, I wanted to highlight interesting thing. It's the systematic issues about negative stigma that we have on people with dementia. I share a story in this presentation that we had a person with dementia and delirium sitting in a chair in the hallway, and people told me not to go near him, and he's aggressive. And when I went in there and I brought Peril, he picked up Peril, he put Peril on his shoulder, and he started to pet Peril, and he was talking to Peril, and a psychiatrist came over and asked, like, what's this? And then he started to tell story about himself. He said, I used to have a dog. And and other people kind of come near and see that, that when he was explaining about his history to the psychiatrist, people really see him in a completely differently. So he was no longer just an aggressive man not to go near him. So in this study that we see that when the clinicians saw how people with dementia actively engage with the robot, telling the stories about themselves, who they are, and their life history, it really changed the way that how we see dementia. So that was a very interesting phenomenon. So people might also ask, like, then what about those companion toy cats? And I would say yes. And we also use the cats, and they also have a golden retriever which is also very cute. And I see them. There are one of the tools in the toolbox, and they do work really well as well. So it really depends on the individual person. Everyone is different. Some people respond really well to cats like this, and other people like Peril better. So it's good to have them. What about virtual reality, VR? So I would say, like, when I put on this VR goggle on this particular patient, and she told me that she couldn't see. So I think there's are very exciting opportunities and possibility with virtual reality, but this is still quite new, and maybe it's a little bit too soon to think of VR. Virtual reality can be a form of therapy that we can use, but it is true that there are lots of possibilities that we can use. But I think we need to do more research to better understand about the functions of the VR, and maybe looking at some of the barriers and or how we can maybe able to ensure safety, and what are some of the specific users' needs. Because it is true that people can become very overwhelmed by the technology. The headset can also be very heavy, and people might think it's tight, uncomfortable. And some people said that they don't really understand how it works and what to do with it. So people kind of need support to navigate when they when they have the headset on. So this is an article that was published about virtual reality. So a study was conducted by Dr. Wendy Moyle in Australia. And in the study that they find some people did enjoy the virtual reality, but other people actually felt scared. And I think, like what I said, I think there's still much to learn about virtual reality. And if we could better understand, it would be really ideal that people would do a study, kind of like what we did with the social robot, the iPad project, is to engage patient partners, people with lived experience, to kind of understand what will work with virtual reality. What are some of the things that they need to adjust in terms of making the equipment a little bit more understandable and comfortable for people with dementia. So finally, and I'm going to talk a little bit about Telepresence robot. You can see on the left-hand side, there's a group of Telepresence robot that we actually have in the market. And on the right-hand side, it's the iPad that we have been using in Vancouver General Hospital for a few years. So I can see, that the Telepresence robot project that we are going to do, it's built on, the work that we have done before with the iPad project and the social robot project. I'm going to show you in the end about this video. It's about this particular Telepresence robot is called Double. And just like briefly to tell you about a little bit about the plan that what we think we could do with the Telepresence robot. Because we know that with the iPad, one of the biggest challenge is the staff in long-term care, they do not necessarily have the time to help the person to set up with the virtual connections. And the Telepresence robot, this Double, can actually help with that, because we can actually program the robot to go to a person's room and on a regular basis, and it will turn on automatically, and it could help people to connect. So we're looking for ways. I'm just thinking about, like, during the pandemic, if we have this robot when people are in isolation, so they're in the room for a long period of time, and we have the robot there to help people to connect with the family, people could actually really say, we all connect with our own family and friends outside, in a community, in using our own devices. In long-term care, like it is very possible that we can do this, but we just have to learn how we can have this technology adapted in the care setting, just like the silent disco headphone that we see young people use it and have a good time and use it really well. And why couldn't we use them in a care setting? Same with the Telepresence robot. We know that in the tech industry, that people have been using this Telepresence robot for many years, and it worked really well. So our next step of our research work is trying to understand what are the things that we need to put in place in order to make sure that people would take it up and use it well, and how we can use it well, and what might be some of the barriers that we need to overcome. This is Double 3. Telepresence robot has some microphones, and it can tilt. The tablet can tilt back and forth, and it can go up and down to make sure that if the person in different position in bed or in a chair, that it can be adjusted. And we chose, this is another Telepresence robot. It's called Giraffe. We chose the Double because you can see the difference between. You can see that this is a lot smaller and this is a lot bigger. And the price of this Giraffe robot is double compared to the Double. So we are very curious to see how this Double Telepresence robot could work for us in long-term care in our next study. So I'm going to take you to let's see, we can go to okay, I'm just going to maximize it.
I'm the Chief Medical Officer of the Bon Secours Heart and Vascular Institute in Virginia. I found Double actually just surfing the web a couple of years ago, and thought that it could have some potentially really helpful applications for my practice. I keep it mainly in the cardiac surgery intensive care unit and use it mostly to round when I'm not here. Before double, I would call the ICU in the evening sometimes, especially if there was a patient that I was concerned about, and it would just be a phone call between the nurse and myself. Since I've gotten double, I have that extra dimension of not just speaking to the nurse, but being able actually to look at the patient, look at the monitor, and just get an intuitive sense of how things are. There's been data that showed that the more patients are seen, especially in the evenings for the night shifts, that the better long-term outcomes there are. So it's a real enhancement. It's another aid to giving better care. The mobility, I think, is the single best feature, and how really easy it is to drive all around. And I've done that from distances, been away at a meeting on the West Coast and then been able to check in or go from the intensive care unit to the step-down unit to check in with a family member who I hadn't gotten to speak to, for example. And you do have a real connected conversation, which is different from a phone call. It's definitely a much more personal interaction when you can look eye to eye. It's nice to be able to just do it from any modality. I've done it from an iPad, I've done it from an iPhone. So to be able to just do that from almost anywhere at any time without having to wait to go through the unit secretary and then for her to find the nurse and whatnot, it's great. So I typically arrive at the hospital at 6:30 in the morning, occasionally earlier, and rarely leave before 7 or 8 at night. By knowing that I could check in at 9, 10, 11, 12 o'clock or before I decide it's time to go to sleep, it does give me some peace of mind, allows me sometimes to leave a little earlier than I might have otherwise. It's a great investment, especially when you consider that there are robotic systems used in medicine in the market that cost 10, 20 times more than what this system cost. The return on investment is huge. It did take a lot to convince the hospital administration that this was a simple thing to buy and that it had significant patient benefits.
All right, so you can see that he used the robot in the hospital setting to do rounds, and I see that we could use this robot in long-term care setting to help residents with dementia to connect with their families. So I'm very excited about the project, and I have already ordered the robot. The robot should be here in a few weeks, and we have our patient, the same group of patient and family partners. So we have Neil, we have Dr. Jim Mann, we have Mario on board to do this work with us. So super excited. So that's all I have prepared for today, and I welcome any questions.
Okay, Lillian, so I'm seeing a question here. When using whatever type of virtual communication system, what measures are taken to ensure there is appropriate accommodation to hearing and/or vision impairments?
That is a very good question. And we work very hard to try to solve these problems. We started with just a phone, and then we heard, our patients saying that they can't see and they get very confused. And so we quickly know that we need a device that will help people to see better. So we bought the largest size of the iPad, and the hearing part is also can be problematic. And I have seen people using headphones to help to hear a little bit better. And we are hoping that this telepresence robot that we have, that we're going to work on, will help to solve that problem. But I also can imagine that people could use, projections or, or headphones with with a regular iPad or with other Android tablets they use that will help to address those problems. Because headphone can significantly improve the quality of the sound. And I would always go for a bigger device so that it help people to see better. Yeah.
Wonderful, and feel free to type any more questions into the chat box. I just shared the link to the video in case anyone couldn't hear or see it. You can watch it again later. Okay, I've got a question here. Does any of this technology come with closed captioning?
Oh, good question. I wonder that I'm not sure the closed captioning will work really well with people. This is a question in my head too, because I'm thinking about like when I do focus group with the Zoom meeting, that it has the function of closed captioning. But like sometimes I think it can be distracting when people are trying to read like facial cues and try to understand communicating, but with another, with the words underneath, and which you could go like come on very quickly and goes off very quickly. That could be confusing. But this is something I have to kind of like test it and see what works for people. And we need people with various, like coming from different backgrounds. And then, I mean, there's a huge diversity with people with dementia. It might work well for some people, it might not work so well with other people. And yes, like most of these devices, you can make closed captioning, but I don't know it would be really the answers for people that if for those people that they could not hear well, because people with hearing impairment could also have other difficulties to try to understand the or comprehend the communication. So I think it from what we have learned in our iPad study, I find that people work really well for people, especially for those in the later stage of the dementia, is using a very person-centered approach. So family knows that the way that they communicate, a particular way that they communicate with their loved ones. So it's the way that they speak. It's not just, having the words out there, but it's a familiar way that they speak with their loved ones. Yeah.
Wonderful, and lots of questions coming in here. This is wonderful. Okay, another question for you, Lillian. Any options, so I assume technology options, for those who have lost the ability to speak English and reverted back to their first language?
Yeah, that's difficult. And I mean, this is a problem that we had in Richmond Hospital. We have a lot of patients who went back to their own language. I gave you the example about the Japanese patients as well, right? So it was like to be able to watch a Japanese movie was very comforting for her, and they gave her a sense of safety. So yeah, I mean, these devices like can people could speak in their own language when you have a live video chat, right? And it helps to address that problem as well. I mean, there in Vancouver General Hospital that we have a device for that would help with translations. So people could request that, but I believe we still only have it in VGH. And other people in long-term care are using Google Translate, and that also could work as well. And people are being creative to try to find ways to do translations. And we have people can sometimes forget that we have provincial translation, which is free, but it is through a phone, and you have to book it ahead of time. Yeah.
Mm-hmm. Wonderful, thank you. Another question, are there also earbuds available? My person won't keep headphones on. So maybe this is in relation to the silent disco, for example.
Yeah, so there are different kind of noise cancellation device that in the market. So silent disco headphone, it's a little bit unique in a way that they're not just noise cancellation headphone. They're connected with a transmitter, so that will allow the therapist to run a music program that many people could hear him. He has a facilitated mic, and he could have like 10 or 20 people, or actually they could have 100 people listening to him at the same time and listening to the same song. So it's an interesting experience that people could be listening individually, but they have that sense of togetherness because they are actually with a lot of people together virtually. Yeah. But if people are just looking for ways that they use just for noise cancellation purpose, or just, they could choose what sound come to them, like any of those noise cancellation earbuds will work really well, that you can find on Amazon, or yeah.
Wonderful.
So the price is becoming very reasonable as well. Yeah.
Mm-hmm. Wonderful. So another question. My dad struggles to learn new technology. Is there anything out there with very simple instructions to help my mom and dad learn?
It depends on what type of technology. Most of these technology that we have in that you can, like the Echo that you buy from the Costco, it's very user friendly. It's pretty simple. Like you plug it in and yeah, you can start to call Alexa, then it will do things for you. And there are also, I think there are online platforms that people will help people to learn about technology. And this is also a very interesting thing that I know there's a program out there that a senior will help senior to learn about technology. And there are also other programs that are on a volunteer basis that will also support people to learn about technology. HWell has done a lot of good work, and I don't know, Dr. Jim Mann probably have more resources that he could offer. Yeah. And but I know there are things available out there. Yeah. Maybe that would be a good program for Alzheimer's Society to launch as well.
Yeah, I think it's a really important one, especially with COVID, more and more things shifting online. It's definitely an important area. Another question, is Double, so for everyone listening, that's the one that was on the video we watched, is Double available for anyone to buy? Do you know if it's being used in any long-term care yet?
It's available for anyone to buy. You can go to Amazon to buy it, and you can go, if you just go double.com, and it's a company in California that you can buy it. And has it been used in long-term care yet? The second part of the question, no, it has not been used in the long-term care. People have used it for education, and people have used it in that particular hospital that we can see the surgeon use it for rounds, but it has never been used in long-term care. That's why we are very excited to see how we can make use of this in long-term care.
Mm-hmm. Wonderful. Okay, another question here. And as I said earlier, if you have any more questions, everyone, feel free to type them into the chat box. How do you avoid problems with getting headphones to consistently work with many different devices in a care home? Any tricks?
That is challenging. Yeah, I know there are so many different devices, eh? And especially the wireless one that you will need to make sure that it's connected with the right right channel, right? So often there are Bluetooth, and I don't know have any particular solution. And sometimes, like even myself, I just kind of have to play with it, and check it and uncheck it, and I don't actually have any magical solution. Maybe getting a friend to help you to see, and yeah, and yeah, I don't have a very good answer for that.
I'm the same. I use Bluetooth for my AirPods, but it's a bit trial and error. Sometimes they connect to different things, my laptop, and yeah, so I think trial and error is a good one sometimes.
Yeah, I just like push the button. Oh, it doesn't work. Push the other button. Oh, now it works.
Yeah, so just having that mindset where you got to try some different things, and it'll all work out in the end.
Yeah, we're all learning.
Yeah. Thank you so much, Dr. Lillian Hung. I just see that we're at the end of our presentation. Time has certainly flown, and clearly this has been so valuable to people, and there's so much interest in this topic, and it's very timely and very important as we see. So thank you so much, and we really appreciate it. And as I mentioned, we will put this up on our YouTube page so that you can watch again. So thank you so much, everyone, and hope you have a wonderful day.